Hello everyone, I'm Dr. Ashritha. I'm consultant Pediatric Hepatology and Liver Transplant in the Department of Integrated Liver Care and Pediatrics from Aster CMI Hospital. On the account of World Hepatitis Day, I'll be giving insights into pediatric hepatitis or hepatitis in childhood. So what hepatitis basically means is just inflammation of the liver, and the most common cause for it is infectious, that is viral infections. So these viral infections includes hepatitis A, B, E, C, as well as other viruses like CMV, EBV, adenovirus, etc. So coming to the modes of spread, hepatitis A and E, which are more common, is usually spread through contaminated water and food. So because of not maintaining good hygiene, if we go on to have these contaminated food products, we develop these infections. Whereas hepatitis B and C usually spreads via blood and body fluids. Regarding the signs and symptoms, they are slightly different in children as compared to adults. So adults, it is very simple because they complain of pain in their tummy, they complain of jaundice, so all these things are very evident. But children, especially who are less than 5 years of age, have very non-specific complaints. They may not present with jaundice at all. So the most common symptoms will be loss of appetite, they become very irritable, they complain of weakness, they don't play normally, they just complain of some non-specific pain in the abdomen. And if we see jaundice, then that is like very specific. Some kids even slip into what is called liver failure. So if they go into this liver failure, then they can have a lot of sleepiness, some blood in vomiters, some bleeding manifestations, and that is actually very ominous. Regarding the prevention of it, so hepatitis A and E, because it spreads through contaminated food and water, just maintaining personal hygiene will definitely prevent these infections. Also, there is a vaccine which is available for hepatitis A, which can be given as early as 1 year of age. So it consists of 2 doses. One is given it's called dose 0, and 6 months later there will be another dose which will be administered. And hepatitis B is started since birth. So 3 doses will be given at 0, 4 weeks and 6 months apart. So these 2 are vaccine preventable. If hepatitis B and hepatitis C is not treated timely with certain specific medications which are available, they can actually cause progressive damage to the liver and causes fibrosis in the liver, that is, the liver becomes hard and can go into what is called as cirrhosis. So early investigations, early diagnosis and treatment becomes very essential. Also in hepatitis A, E and B, there is a rare chance that the child can slip into liver failure, as I've already said, and if this happens, the child will require intense observation, supportive care, as well as sometimes even liver transplantation. So as I said, the early diagnosis becomes very important, and that is usually done based on our clinical examination, the symptomatology of the patient, as well as certain blood investigations and like ultrasonography. Coming to the treatment, so hepatitis B and hepatitis C has specific medications which can be administered for a specific duration of time, especially if it is hepatitis C. For hepatitis B, the duration of treatment just goes on based on certain parameters which we have to monitor. Whereas hepatitis A, E and other viral infections are just supportive. So when these infections are identified, it is essential that the child is in hospital or at least under an OPD follow-up, so that we can recognize early signs of deterioration and treat them adequately.